I'd like to welcome Annajane Yolken with Protect Families First. Thank you for joining us today.
Thank you so much, Kate.
Put out the release yesterday with Kristens Law making its way through the General Assembly, your continued opposition to this piece of legislation. Wanted to have you here on the show to talk about this and what you're hearing from people and why you're so opposed.
Yeah, we continue to stand with the medical community, with public health experts who work on overdose prevention every day, and with the recovery community in opposition to this bill. While we understand the intent behind the bill, we feel like the bill as it stands now is really poorly worded, would really double down on some ineffective drug policies we've been doing for years that put people in prison instead of getting them treatment and help. And that would get really, really low-level people, mostly people who are selling drugs to support their own habit. And we feel like those are not the people we should be going after. We should be going after drug kingpins, drug traffickers, and that this bill would not do that. So we continue to stand opposed.
We've had this issue on GoLocal Live before. You talk about it. The letter that had gone out several weeks ago to the folks in the healthcare community, with all of this opposition, why do you think the supporters are able to get the traction that they are?
Yeah, I mean, again, the medical community stands strongly in opposition to this bill and continues to stand so. And we have tried to be around the table, but we have not been able to. We feel like our input has not been listened to. And, we understand that people are suffering and there's pain and people want to do something. And we really understand that. And people want to do something during an election year, especially. And so while we understand that, we just feel like this is not the way to go. This is not the right approach. And just because it's an election year and people want to do something doesn't mean we have to do this.
So we're keeping an eye on Kristens Law, but talk with us a little bit about Protect Families First.
Yeah, so Protect Families First is a nonprofit that advocates for drug policies and practices that prevent overdose deaths, promote community health and safety, and keep families intact, specifically by keeping people out of prison for drug use, and looks to alternatives such as public health interventions.
Yeah. Has the state, or let's focus here in Rhode Island, made any gains in that approach? We've seen, comprehensive justice reform looked at and pushed through. Has Rhode Island taken any steps? And I know in this opinion, Kristens Law, in your opinion, would be a step back.
Yes, absolutely. So I'm proud to be from Rhode Island and have other states looking toward us as public health experts to address the overdose crisis. Rhode Island has been a leader in taking public health approaches, equipping people with naloxone, the overdose reversal drug, increasing access to treatment, including for people at the prison. And that's actually seen a decrease in overdose deaths. Rhode Island was one of the few states last year that saw a decrease in overdose deaths. We feel like we need to continue on those efforts and not take a step backward and double down on ineffective incarceration-based policies.
Well, I appreciate your taking the time to continue to shine the light on this issue. We're in the waning days of the assembly here, but there's many issues that folks are fighting for. And again, with Protect Families First, fighting against this Kristens Law and explaining the reasons why. Annajane, I appreciate your taking the time
Thank you so much, Kate.
today. I'll let you go. I'll welcome our next guest here on Federal Hill.
Thank you.